All right, we are going to set up an A-line today. The supplies that you will need to grab from the supply room are the kids kit, the pressure bag, and the transducer. You will also need to get whatever the provider orders. It will be a normal saline, it may be heparin solution, and it may be papaverin solution. So you'll just need to make sure what you need to get before setting this up. For demo purposes, we'll use the materials provided by the education department. So you will first take out your transducer kit. I prefer to lay it all out and orient myself to the line first. There's a few pieces that we have to alter to make our A-line work for the pediatric population. So we will need to take off this cap here. So it's right by the pigtail if you orient yourself to the line. You'll take this clearish white cap off and place one of these white caps on. This comes in the transducer kit, but we also have these in the room if you happen to lose it. And then in order to utilize our kids kit, we will take this whole piece off, including the stopcock. So you'll just take this off and place your kids kit on like so. The next step is spiking our bag. So this one's already been spiked, but typically what you would do is you would spike the bag and then undo this, keeping it sterile, and push all the air out of the bag to make sure no air is getting pushed into the patient. Then you'll re-spike your bag and you'll prime your line. So in order to prime the pressure tubing, you need to pull on the pigtail. So you'll pull the pigtail like so. It's important that you prime this piece. So you'll take the white cap off and pull the pigtail to prime fluid into this smaller piece. You'll reapply the white cap. And then you will need to prime your kids kit. So you don't have to change anything about the stopcock. It'll be already off to the line like so. And you'll just pull the pigtail to prime it all the way to your patient. You'll also need to prime the kids kit syringe and this line. The way you do that is you turn it off to the patient. You use the pigtail once more and you pull the syringe. You need to pull it all the way so that there's fluid in this syringe. Sometimes there's a little air that comes off. It's okay to push the air out and then re-secure it onto the line. The last and final step is placing the bag into the pressure bag. So you'll slide it through here and hook it on this little hook so it stays in there. And then you will turn this stopcock so it's off to this opening and you'll pump it up like so. You can see air going into the pressure bag. The way that you know that the pressure bag is adequately pumped up is that this will turn green. I'm not going to do that because it does take a while, but that's how you know. That's also something you would check when you're assessing your A-line, is to make sure that the bag is in the green. And that's it.